Hello everybody, in this video I'm going to go ahead and teach you how to do a simple lac repair as well as 4 commonly used suturing techniques. Go ahead and drop some lidocaine and epinephrine and inject around the wound site. Always make sure you aspirate first before you inject, making sure you're not in a blood vessel, and as you pull back, you go ahead and inject the medication. Once done with that, cap your needle. The first one we're going to talk about is a simple interrupted suture. Start at the center of the wound. Use your needle driver as well as your pickups, and making sure you approximate the edges. Make sure the knot is pulled to one side and not over the wound itself, and that could cause an infection. The next one we're going to talk about is the vertical mattress. Here I'm putting 4 dots. You want to get a good bite and go far, and then you want to change the direction of your needle and then go near. What I'm using is pig skin, so it's a little tougher. Human skin is going to be a lot softer. So as you can see here, I'm going to change the direction of needle and now go near. The thread should end up on the same side. Sometimes the thread itself is going to be very hard to work with, so you just want to give it a good tug and that should straighten it out. So the simple Burried suture, you go from deep to superficial, change the direction of your needle and then go superficial to deep. Pull along the direction of the wound itself, so making sure you're bearing the knot. Cut the tails very short as you don't want it to cause an infection. And the final suturing technique is the horizontal mattress. This is a good suturing technique for wounds that are under high tension. You want to drive your needle to one side, change the direction of the needle, and you should end up on the same side that you started on. Okay, and once you're all done with your sutures, you want to make sure you clean up the area and get rid of all sharps. This concludes our video. Please tune in for more great videos. Thank you very much.